Hello, I'm Dr. Ken Landau. Thanks for watching. Let's talk about genital herpes. Used to be in the old days. Herpes type 1 was around the mouth, fever, blister, cold sore. Herpes 2 around the genitals. That was before the sexual revolution in the 1960s. Subsequently, now about half of genital herpes is type 2, the traditional type 2, but half of genital herpes is herpes type 1. And you can't tell the difference just by looking. 50 million people in the United States have genital herpes, about 1 million new cases a year. We evaluate people between the ages of about 15 and 50. About 12% have genital herpes if they're sexually active. If we look at other areas of the world, it's even higher. In Africa, it's greater than 1 in every 2 individuals. The virus belongs to a family, the herpes virus family, that contains not only the herpes simplex 1, herpes simplex 2, but it also contains the varicella zoster virus, chickenpox virus, shingles virus, the monovirus, Epstein-Barr virus, and cytomegalovirus. Has nothing to do with cleanliness or dirtiness or being good or bad or being faithful or not. There's been a decrease in the incidence of the orolabial herpes, the cold sores and fever blisters, over a period of the past 30 or 40 years. And that means that since we don't have the antibodies, that people in their adult years are more susceptible to catching the herpes if they're exposed. In the old days, when your mom or your dad or your grandparents gave you a little kiss on the cheek when you were a child, you would be infected, and then you would be relatively resistant to getting the genital herpes. Not so anymore. Children tend not to have as high an incidence of the orolabial herpes as they did once upon a time. If we look at genital herpes, it's more common in women than in men. About 1 in every 6 women, 1 in every 12 men have the virus. It's more easily spread from men to women during sex than from women to men, and the incidence of genital herpes, fortunately, has been falling too. 1999, it was about 18% of the population. Nowadays, it's only about 12% of the population, but it's not uniformly spread. It's more common in women than men, African Americans than Caucasians, more common in men having sex with men, and more common in immunosuppressed individuals, and it's more common in African Americans, even when they have the same number of partners as Caucasians. Most people who have the herpes totally unaware that they have been infected. If we look at people who test positive for the antibodies, in other words, they have the virus in their systems, 90% of the time, they are unaware that they've ever been infected and claim they've never had a cold sore. And that's absolutely legit, because most of the time, the virus is asymptomatic. Once you get the virus, once the virus enters your body, it stays there until the day you die. Most of the time, it is inactive, and in many individuals, it always is inactive. It does not cause any necessary symptoms just because you're infected. So the type 1 herpes, when it happens to be around your mouth or your lips, causes the typical fever blister on the outside of the skin, causes a little rash, doesn't get into the mouth, doesn't get into the nose, tends to be milder than genital herpes. The genital herpes pass through sex, either type 1 or type 2. Doesn't matter whether we're talking about vaginal sex, oral sex, anal sex. And the virus can be spread from the genitals to other areas of the body, or other areas of the body, orogenital herpes. So it can be spread from the mouth to the genital area. And it's important to realize that you can be infected with a type 1 virus, and you can be infected with a type 2 virus, and then any other exposure you have, you're resistant to. So the recurrences that you get are all your own virus that's been living for years or decades inside your nerves. And when you get the infection, that's your own virus that's coming back to the surface of the skin, even though you were not aware that you were carrying it for the weeks or months or years or decades. And you have no idea where you caught it in the overwhelming majority of people. Well, you can shed the virus from otherwise normal appearing skin. So in people who are infected with the genital herpes, who have never ever had any kind of symptom, 1 out of every 10 days, let's repeat that, 1 out of every 10 days they are shedding the virus. Live virus is present in the genital area of the skin in people who have never ever had any symptoms but do test positive for the virus. If we look at people who have a history of genital herpes, still 1 out of every 5 days they are shedding the infectious virus. Now, the concentration of the virus and the likelihood of contagion is greatest in the day or so before an outbreak, the day or so after the start of an outbreak. So in that time period, that's when you seem to be most contagious. But most people who are infected with the genital herpes are infected from having relations with a person who was unaware that they had the virus and did not have any active infection at the time when the virus was passed into your body. Now, that brings up a major issue. Let's say you have a long-term monogamous relationship. Neither person has any clinical history of herpes. Neither person is aware that they have ever been infected. And all of a sudden, one of the partners develops an infection with the typical genital herpes lesion. Who is at fault? Well, there are going to be lots of accusations and recriminations and all sorts of claims of unfaithfulness and unrest and anxiety. However, there shouldn't be, because the herpes that you have or you develop for the first time might be a herpes that has been inside your body for years or even decades and now is occurring for the first time on the surface of your skin because your skin was irritated. It had nothing to do with the virus, but just was the skin was irritated or something caused the virus to come back down the nerve and into your skin and now make its first appearance. So you can't say whether it's your own herpes that now is recurrent, or is it an infection that you might have contracted from your partner, but your partner could be totally asymptomatic, never have a history of having had the infection, but be asymptomatically carrying the virus for years or decades, even from long before your relationship. Now, it seems that the herpes virus is more readily passed in men having sex with men than in heterosexual men, but it's more readily passed in heterosexual women than in women having sex with women. And as I mentioned, over the past 30 years, there's been a decrease in the incidence of the orolabial herpes, which means we're more susceptible as we get older. As the virus first enters the skin, it enters through a break or a tear in the skin or through the mucous membrane. Then it travels inside a sensory nerve and lodges in an area around the spine. And when it occurs in that area around the spine, it stays there for the rest of your life. If it happened to enter around your mouth, it goes to the trigeminal ganglion in the back of your skull, in the base of your skull. The primary lesion, the first time the virus goes into your body, typically over 90% of the time, well over 90% of the time, it will not cause any symptoms. You will not know that you have been infected. And oftentimes, the first evidence that you're infected is with what we call a recurrent lesion. A recurrent lesion is that typical small area of skin involvement where you see it and you say, oh my God, where did that come from? Well, it's important to understand that the overwhelming majority of people who have cold sores or who have genital herpes lesions are totally unaware. And when the lesions are mild, they're often mistaken for a pimple or something like that, or a shaving irritation. When you do develop the primary infection symptomatically, which again is very small percentage of the people who have first exposure to the herpes, has an incubation period of 4 to 7 days. Then you have some mild itching and burning and tingling, and then all of a sudden you have some flu-like symptoms and swollen glands, and you have pain that's in your buttocks and your genitals, or sciatic nerve pain that radiates down your leg. You have a longer duration of the lesions. You have more viral spreading. You're more contagious. Sometimes people with the primary lesions develop fatigue and nausea. Women can develop abnormal vaginal discharge, and you have a fever and feeling of pressure in the belly. And then you develop these crops of reddened skin with blisters on top. And it occurs both on the right and the left side of the body, so it isn't just limited to one side or the other. It can be on both sides, near the center. And it continues over a course of several days. Then it ulcerates, then it crusts, then it heals. Tends to be present for longer than the recurrent lesions, tends to be more severe, tends to be associated with a greater viral load and be more infectious. But those people aren't going to be having sex because they are significantly symptomatic. On the other hand, that's a very small percentage of individuals. And those individuals are going to have even a worse symptom, worse attack, if they have not previously had infection with the orolabial herpes. And remember, the overwhelming majority are not going to have any kind of symptoms. The location of the virus, well, it's going to start around the vagina or the labia or the cervix or the buttocks or the anus or the inside of the thighs in women, and in men it's going to be on the tip or the shaft or the foreskin, or it's going to be on the scrotum, or sometimes the suprapubic skin, or sometimes it's on the buttocks, and sometimes, depending on where your fingers are, your fingers can get the virus too. You can develop what we call a herpetic whitlow. And in people who have eczema, it can spread onto the eczema if the eczema is relatively severe, the childhood eczema, now still present as an adult. And recurrent attacks, well, the overwhelming majority of recurrent attacks, remember, the time when you're shedding the virus, asymptomatic, you don't even know. But if you develop a symptomatic attack, a symptomatic recurrent attack, it's going to be shorter, it's going to be less severe than the primary attack. You're going to have a prodrome for several hours to a day or so of some burning and tingling and itching where the rash is going to appear, and it's going to mimic the previous recurrences, so it tends to be in about the same spot all of the time. Some of the people are going to develop some pain in the lower back, maybe even some radiation down to the leg, and then all of a sudden you get a little patch maybe about the size of a dime, maybe one, maybe two areas. They're going to have some reddened skin and then some blisters. And again, the same general area each time. The flares are going to be caused for unknown reasons. Sometimes it's stress or an illness, maybe a new sex partner, or maybe it's related to a period or some fever, maybe some friction from sexual relations. On men, the occurrences, the recurrences, are going to be in exactly the same location on the penis or the scrotum, the suprapubic area about the base of the penis. Sometimes they're on the buttocks, or sometimes they're around the anus, depending on where the virus entered the body and where the nerve is traveling to. It's always basically either the right side or the left side, and typically just near the center. Women around the labia, typically relatively close to the vagina, but it could be on the buttocks or it could be on the hips. The blisters tend to last only a few days as opposed to a week or more with the primary attack. They crust over after several days and they're gone within 4, 5, 6, 7 days. That's it. All done. Over. Now, average recurrence rate, 1 or 2 per year. That's not uncommon, but some people don't get any recurrences. The overwhelming majority of people, remember, who are infected with the virus aren't even aware that they're infected. But sometimes people can mistake an area maybe as an insect bite or as ingrown hair or a small ulcer, a fissure, a scratch mark, or a cut or a scratch, and that might actually be the herpes. The difference between the herpes 1 and the herpes 2 has to do with the frequency of recurrences. If you happen to develop your genital herpes with the type 1 virus, chances are it's going to recur at most less than once a year. If it happens to be the type 2 virus, chances are, if it's going to be recurrent, it's going to be recurrent maybe 4 or 5 times a year for the first several years, and then with decreasing frequency, it becomes less common as you grow older until finally it stops coming back altogether. Now, you may develop the recurrences in areas other than around the genitals, so it could be on the butt or on your groin or on your thigh or on your finger or unfortunately in your eye. Most of the time it's just going to cause the skin lesion, but sometimes it can cause meningitis or some other kind of problems. There's an issue with pregnant women. What about the potential passage to the unborn child? Well, that's an issue. And if the mother has the recurrent type of herpes, that typically is not a problem. If a mother develops the primary infection during the time when she's pregnant, especially during her third trimester, that is a potential problem, and it leads to neonatal herpes in about 3,200 newborns every year. It's not very common, but it's common enough so that we worry about it. And the question is, what's the risk to the child? Well, if that infection in the mother occurs for the first time in the third trimester, the child may be infected up to half of the time. And it's a very severe infection that involves the eye and the brain and the liver and the lungs. So what are we to do? Well, for the overwhelming majority of women who have recurrent herpes, it's not an issue. Some obstetricians believe that women with a history of genital herpes, well, maybe after the 36th week they should take some prophylactic medicine, some of the antiviral medicine to reduce the shedding. It's never been shown necessarily to be of any special value. If the woman tests negative and her partner tests positive, it might be a good idea not to have sex during the third trimester. Cesarean section is always a possibility, but that should only be for women who have active lesions at the time, not necessarily for a woman who has a history at some point in the past of having genital herpes. And breastfeeding is perfectly acceptable in women who have a history of genital herpes, not going to be spread through the breast milk. Now, if you happen to have genital herpes, that's an ulcer, if it's an active lesion. And if you have an active lesion, then it's more likely that you can pass the HIV, the AIDS virus. So you have to be careful depending on whom you're having sex with. If the virus happens to be present, the genital herpes virus present on your buttock or on your thigh or on your hip, chances are it's somewhat less contagious because it's an area that's not as likely to be touched during sexual relations. Now, there's a psychological problem of having the herpes. A lot of people blow it way out of proportion. It becomes a complex social issue. But remember, it's just a virus, and it's a virus that you've been carrying for decades, oftentimes. And the fact that you happen to have an outbreak, well, that shouldn't cause any kind of anxiety or depression or guilt or fear of telling your sex partner or confusion or sadness. It has nothing to do with that. It's just a virus. It's just like having a cold. Unfortunately, in our society, as I said, we blow it way out of proportion. And basically, remember, you get one infection with herpes type 1, one infection with herpes type 2, and then all of the subsequent infections you get are your own virus that are just coming out. Now, clinically, when we look at the skin, sometimes it's hard to differentiate the genital herpes from a pimple, a bacterial infection, irritation from shaving, or sexual trauma, or syphilis, or a canker sore, or aphthous ulcer, a drug eruption, or a type of a tumor. But that's for the doctor to decide. How we make the diagnosis, we look at the lesion. Typically, we don't need anything more. No culture is necessary. Culture is actually not very helpful. Oftentimes, they're negative even though the virus is present. We have a polymerase chain reaction test that can be done, but that's hardly ever necessary. Pap smears are not helpful. Microscopic examination of the area of involved skin typically is unnecessary, unhelpful, and unwise. There's blood tests that can be done. In the old days, wasn't very specific. Nowadays, we can differentiate the type 1 virus from the type 2 virus on the results of a blood test. But typically, we don't have to do that, and sometimes it can be confusing. The government does not recommend, the United States Preventive Services Task Force does not recommend that people routinely be tested with a blood test. And the reason is that if you look at 100,000 people, if the population prevalence of genital herpes is 16%, that means 16,000 people are going to have true positive tests, but another 16,000, the same number basically, are going to falsely test positive, so they won't have the virus, but the test shows that they do. And that can lead to, again, a lot of emotional difficulty. It's a simple DNA virus. There's nothing special about the virus. We know all about the virus, so it's not any mystery. There's no problem, if you happen to have the virus, about snuggling in bed or sharing a bath or a shower, or putting your clothes in the same washing machine or using the same toilet. Women shouldn't douche because it's going to remove some of the protective vaginal bacteria and then perhaps increase the likelihood of infection. Certainly alcohol and drugs tend to lead to more risky sexual behavior, so there's a problem with that from that standpoint. If you touch an active lesion, you should wash your hands right away. You should delay sex until the area is healed if you have an active sore, because of the potential, if both partners are infected, the potential is that it might become super-infected with the bacteria. In long-term monogamous relationships, when both partners are negative for the virus, there's no worry. If both partners are positive for the virus, there's no worry, you're not going to catch it. Virus is easily killed by soap and water. It only lives for a couple seconds outside the body, and condoms, while they're talked about frequently, are probably a lot less effective than most people believe, at least for prevention of passage of the herpes simplex virus. They only work about 50% of the time. And remember, they only work in areas that are covered. So the penis, on the other hand, the virus can occur in the suprapubic area of the skin, on the scrotum. None of those areas will be affected one way or the other with use of a condom. Now, people can take medicine, take the oral medications, once they develop an infection, typically the primary infection, which is very unusual, or the recurrent lesion. Usually, people take the medicine to suppress the development of new sores. So from the time you develop the itching, burning, numbness, or tingling of the area, that's the time when you should take the virus, take the antiviral medicine. You shouldn't wait for a day or so after the appearance of the sores in your genitals, because the medicine is basically ineffective. So you could take the dose, a suppressive dose of either acyclovir, or you could take a suppressive dose of the Valtrex, available as valcyclovir, the generic, or the Famvir. And if you take that from the moment you develop the itching, burning, numbness, tingling, you may prevent the outbreak. On the other hand, if you wait for more than 24 hours after the outbreak appears, the pill will do absolutely nothing. Some people who get frequent recurrences, say more than 3 to 6 per year, take the pills on a daily basis to suppress the recurrence of the virus. That's okay, and that seems to work. And you should do that if you're going to do it for about 6 months, and then stop and see if you're still going to get the recurrences, because sometimes the clock is reset. And while the pills seem to work quite well, they do reduce the number of recurrent episodes and do reduce the shedding on the skin and do reduce the contagiousness, they don't eliminate it. So you can still pass the virus on even though you're taking the antiviral medication. Is there any difference between taking the acyclovir and the valacyclovir or Valtrex and the Famvir? No. Worry about the price, the consistency, the frequency you have to take the pills. But anyway, that's all there is to genital herpes. You know the whole story. Thanks for watching. I'm Dr. Ken Landau.